Hi, my name is Dr. Lexie Wang, and on today's episode of Face the Facts, we are going to be talking about biostimulators, more commonly known as Sculptra or dilute and hyperdilute radiesse. Those are the commonly used forms, at least in America right now. So what these are essentially chemicals that we inject into you, and they cause a wound healing response and thus encourage your body to send inflammation to the area, and in that process, your body will create and generate collagen. So this is a collagen stimulating product. It's injected just like how we would inject natural or normal filler, as in it can be used by a needle, it can be used by cannula. The only difference is that unlike traditional filler, you usually should not see a substantial change in the initial treatment. The nice thing about this is that it is a very gradual change because it relies on your body to do the immune response. So it's not going to be a right away change. This is not something where you come in one day and you leave looking completely different. You will require time to see the full effects of how these biostimulators work. And we're talking time on the order of several weeks to months and sometimes even to a year afterward, okay? Now, this is beneficial for some people who say that they want to do something that's a little bit more natural for them. They want a gradual change. The other good thing about doing these treatments is that it truly is adding back collagen, which I'm sure you've heard about that term by now, but it's one of our key anti-aging ingredients. So we like to add back collagen. However, I do also want to put the risk there that the way this works is by encouraging the immune system to do its job. So it actually works by creating scar tissue. This is what biostimulators do, is it creates scar tissue, and that scar tissue is the collagen. So the reason this matters is that if you're ever gonna have any procedure afterward, it does not need to be plastic surgery, but any procedure afterward in the same area where you've had biostimulators, please, please, please tell your surgeon that you had work done there, because they will encounter scar tissue when they lift up the skin underneath and take a look at what's been there. So please be kind to your surgeon, tell them to be prepared for that. Anytime you have scar tissue there that wasn't there before and we weren't expecting it, puts you at higher risk for all kinds of complications like infection, nerve damage, all these other bad things. So we need to know that there's scar tissue there. It's okay that you did it, but we need to know that's there so we can be prepared. So that's my thoughts on biostimulators. Feel free to leave any questions below if you have any other things you want us to talk about, but that's it for today's episode of Face the Facts.